We scrambled after the event, got our heads together, knowing that the most important thing for us at that time was recovery. And what were we going to do with this mess that was thrown into our laps instantaneously? Again, with collective thought, and I have a great staff that works with me and for me. We put our heads together and we brought the grief trauma specialist in to deal with the situation, to deal with counseling. We knew we were going to need counseling of some nature. I don't think we knew what degree that we were going to need and how long this was going to last. Most people in the real world that don't deal with children or people at this level feel we should probably just move on and let's get over it. Okay, it happened. Let's deal with it. Tomorrow's a new day. Let's start again.
Easier said than done.
Easier said than done. Our dilemma is, again, everybody brings and I've used this analogy before, every child brings a different suitcase to school. Some are empty, some are full, some have lost parents, some have lost other family members, and an event like that stirs all those emotions back up. It also brings forward a sense of it brings forward a sense of children coming forward with depression. It illuminates those types of things, childhood depression, depression sometimes in our staff. So the mental health component is extremely important. We've had a number of my employees that have had family members that have committed suicide. I have a family member that attempted suicide and is now debilitated since about 1978. So it affects us all differently. I think it's vitally important that we, again, as proactively as we can address a situation that's really been thrown into our lap. And that's a big piece about suicide.
In the Bereavement Center, we serve many families that are grieving because someone suicided in their family. And we've gone into many schools where there's been a suicide, and into the workplace when there's been a suicide, and to first responders, police officers when there's been a suicide. So it's something that we do frequently, and it's really hard to comprehend and understand and figure out why this happened and to really wrap your head around it. And so we're in the business of postvention and grief support. We don't want this to happen. We really want this to be preventable. And it is treatable to have these feelings.
There's statistics show that hyping this up is not good.
Yeah, I think, again, because kids love that drama. Anything that we do that creates energy and interest around something, even if it's negative, that age group of children, it's really what they long for, what they're looking for, and we don't want to contribute to that. I think that it's really important across the board, not only for the media, but for parents, for educators, that when stories like this come out and we hear about children doing things in a pack, 7 people, it becomes that sense of a copycat. It's a lot of negative energy, negative press that can be built around that story. So it's really important, I think, that we take a look at that and we say to ourselves, what message do we need to convey here, and get rid of the other message. If the message is, okay, we've got a bunch of young people out here who are distressed, who are worried, who maybe are struggling with depression, that suicide is something that they think about, then we need to reach out to them and talk about how you cope differently. We need to educate their parents as to the warning signs. There's a lot of proactive things we need to be doing for those children, but not making it a story in a story by itself that kids then latch onto as a way of trying to get some attention, even if it's negative attention.
I'm not saying the media has done anything wrong in this particular incident, but when in other cases, when media has sensationalized a suicide, it can encourage other people to copycat. That we don't want to have happen.
Again, the important piece is to let somebody know you're having difficulty, whether it's depression, whether you're being harassed by somebody, bullied by somebody, or you observe it happening somewhere else. Our goal is to get people help and to get them to the right professional. And again, every family, there's really no roadmap, so what I'd like to use, the analogy, I'd like to put a compass in their hand so they can at least try to chart their own path from family to the professional that's going to help the family. Again, it's a tough thing to talk about. Nobody wants to talk about suicide, but we must have that discussion with our kids and, quite frankly, with our community.
It doesn't go away overnight. You can function, you can cope, we move on. You go through your day-to-day lives. But the children who were eyewitnesses to what occurred, have difficulties in different ways than children who just were students in the building that day. And then I think when you take the observing a trauma and you couple that with, maybe I've also been experiencing some of my own anxiety, some of my own depression, some of my own worry, and you put those things together, you got the makings of a great storm for some children who maybe don't have the capacity to cope.
Parents need to be informed about suicide, which they can just Google suicide and get a plethora of information on the internet. They need to listen to their children, talk to their children, and get help for their children, whether it's medical or psychiatric or mental health help for their child if needed.